Hi, my name is Allison. I'm a therapist here at Complete Physical Therapy. Today I'm going to show you how to perform a massage we call MLD, which stands for Manual Lymphatic Drainage. This is super helpful for folks who are dealing with swelling. You might see that after surgeries. We tend to see this a lot after knee replacements. So this is something that you could do to help a loved one at home who's dealing with swelling. The idea behind it is we want to help get fluid out of the tissues and help create movement out of your body. So our lymphatic liquid or fluid travels through our vessels, and this is something that goes throughout our lymph nodes and eventually through our kidneys, where we eventually excrete it out. So when we do this massage, today we're going to use the example of doing it down the leg. You always want to start close to the body. So we're going to start in the abdomen. And what I'm doing is I'm just starting off by applying gentle pressure. I think of it like little tugs of the skin. This is going to help kind of clear the way for that fluid to move. So we always want to start it at the lymph nodes. After you spend a minute or two here, you can start working your way into the groin. Like I said, this is very, very superficial, so it's not a lot of pressure, very, very light touch. You can spend a little bit of time in that hip crease here, working through the lymph nodes, and then working your way down the leg. You always want to kind of stroke your hands towards the body. That's really important with this type of massage. So we're always moving towards the body. And we always want to start close to the body. And over time, you can slowly work your way down the leg. There's really not a wrong way to do this, but there are a couple strategies that I use to help really encourage that fluid. One of the areas that you can kind of start to move is along the inner knee. We've got some lymphatic vessels that run along the inner knee that this actually kind of feels good too, but just to kind of help with that main section here. I'm kind of just using one hand over the other, and like I said, very light touch. And kind of work along the sides of the knees here, kind of almost swooping, making a swooping motion. And you can spend as long as you want on this, but always make sure you start from the body and work your way away from the body. Always moving towards the body. And kind of work as long as you'd like. Eventually, you can even work your way into like the calf and into the foot. Because a lot of times after surgeries or after significant injury, you can even have swelling into your ankles or even bruising down the leg. So this nice light touch can go all the way into the calf, working under the knee, and even into the foot too. So feel free to try this out, help a loved one maybe who's going through some surgeries or injury, and give it a try.